I'm Karen Felstead, and I'm here to talk with you today about the Bayer Veterinary Care Usage Study, a study that was done by the NCVI, Brachy Consulting, and Bayer Healthcare. A study that was done by the NCVI, Brachy Consulting, and Bayer Animal Health. Before we get started with the results of the study, let's talk a little bit about some of the trends we've been seeing in the industry and that were the genesis for this study. First of all, it's important to remember that regardless of what the Bureau of Economic Analysis says, the recession is not over for many veterinary practices. One of the pieces of information that the NCVI has been tracking has been the number of patient visits for the first 9 months of 2010 compared to the same period in 2009. 55% of veterinary practices are still reporting a decline in patient visits through the third quarter of 2010. About 15 practices say that their patient visit traffic is flat, and the other roughly 30% are seeing an increase. Only about 13% of practices are seeing an increase in patient visits of above 5%, however. Consumer confidence is at one of its lowest levels ever since, I'm sorry, I gotta say that one again. Consumer confidence is at almost its lowest level in 15 years, and I don't think anyone is really confident that consumers will be as free spending in the next few years as they were in the years leading up to 2007. Veterinary medicine for many pet owners is at least somewhat of a discretionary item, and if consumers are holding on to their dollars, that's not going to help us return to the financial success that we had several years ago. What's important to remember, however, is that this is not all about the recession. If you look at data starting from 1996 through the period 2006, and this comes from the AVMA U.S. Pet Ownership and Demographic Sourcebook, a very robust study of pet owners, you'll see that while the number of pets was growing steadily from 1996 to 2006, the number of veterinary visits declined. There was actually an increase between 2001 and 2006 in the number of dog visits, but the decline in cat visits was so severe that it brought the total visit number down. Like I said earlier, those are pre-recession numbers. We also can look at some other studies and see that, again, pre-recession, we're seeing similar trends. So during this time period when pet numbers were increasing, transactions per full-time equivalent veterinarian were flat or declining. Median new clients per full-time equivalent veterinarian were down. Median active clients per veterinarian were down. Total veterinary visits were down. Veterinarian visits per pet were down. The percentage of households with pets who visited the veterinarian were down, and patient visits per week were down. It doesn't matter what study you look at, and these numbers come from 5 or 6 different studies, you see the same trends. What's particularly interesting is that you see the same trends whether you look at pet owner studies or you look at studies that analyze the activity within veterinary practices. So it's very clear that we've been seeing a decline in pet owners bringing their pets to the veterinary practice for care over some period of time stretching back to the early 2000s. There's a couple of things that are concerning about this. One of them, obviously, is the economic impact on veterinary medicine, but perhaps even more importantly is whether or not pets are getting the care that they need. And what has become very clear is that they're not. If we look at the information from the AVMA Pet Ownership Sourcebook, we see that in 2006, almost 24% of pet-owning households spent zero at a veterinarian's office. 27% of those pet-owning households spent somewhere between $1 and $199 per year. And that phrase pet-owning household is an important one because a pet-owning household may have more than one pet in it. So you could have $200 of care being spread out over not just one pet, but 2 pets, 3 pets, 4 pets. And you can't get much done in the way of basic veterinary care for $200 a year, even for one pet, much less for several. Only 22% of pet-owning households spent over $500 a year at the veterinary practice. And $500 a year is a pretty minimal threshold for a pet that has any kind of a real disease or surgery or an accident. Another way of looking at it is to look at the doses of heartworm preventative that pets are getting. This information comes from the 2010 AHA State of the Industry report. And what they saw is that the percentage of dogs who were getting at least one dosage of heartworm preventative in 2009 ranged from about 22% to about 43%, depending on the region of the country. So that's for dogs that were getting just one dosage of heartworm preventative. If you look at the percentages of dogs that are getting the full complement of 12 dosages a year, it's much less. And if you look at the percentage of cats who are receiving regular heartworm preventative, those numbers are actually absolutely abysmal. To look at this problem in another way, we have information from the NCVI Vet Partners profitability estimator showing the profit margin of the average veterinary practice. That profit margin is about 9.9%, and that's considered to be a fair profit margin. There are some practices who have what would be called a superior profit margin. About 12% of users rank in that category. Another 27% are in the excellent category, and they have profit margins of 16 to 18%. About a quarter of users fall in the good category, and then we have about 37% who either have a fair or a poor profit margin. About 12% of users actually have a negative profit margin. And that profit margin calculation, that's the amount of money that's left over in a practice after all normal and necessary operating expenses are paid at fair market value rates. It's the gold standard measurement of the financial success of a small business. And obviously we have a long ways to go in that regard. An interesting study was done by a group called SageWorks, and this was published on the Forbes.com website last year. And they looked at the profitability of a large number of small businesses. Their profitability number for veterinary practices was 10.5%, pretty close to the 9.9 we're seeing in the NCVI Vet Partners profitability estimator. That is much lower than CPA offices who had the highest profit margin at 17.1%, chiropractors at 16%, dental offices at 15.4%, and on down to veterinary practices at 10.5%. So again, we're clearly not running our businesses in a way that allows us to be as profitable as many other small businesses, or there's some kind of a fundamental difference between veterinary medicine and other small businesses that doesn't allow us to be more profitable. I don't think anybody really thinks that veterinary practices can't be more profitable, because there are ones out there that do it. It's just the number of practices that reach those high levels of profitability of 20% or more are very small. So we have clearly a couple of disturbing trends here. The most important one is that pets aren't getting the veterinary care they need. The second one is that this clearly must be having an economic impact on the profession. And of course, the key question is can this trend be reversed? One of the goals of the Bayer Veterinary Care Usage Study was to identify why veterinary visits are down, and more importantly, what kinds of activities can be engaged in order to reverse that trend. So let's talk a little bit about the study before we share the results. The research team consisted of Brachy Consulting, who was involved in the project design and management, the NCVEI, who provided expertise in the economics of veterinary medicine and practice management. The field studies, the market research was done by Ipsos Forward Research, and the Bayer marketing research team provided oversight from Bayer. We also had a number of university consultants, including professors from Southern Methodist University, Texas Christian University, and Kansas State. Dr. Slocum and Dr. Crone from Southern Methodist University and Texas Christian University had been involved in the previous Bayer Brachy study and in the AVMA Pfizer Business Practices study. The three professors from Kansas State have also been involved in a number of studies related to veterinary medicine. Just a bit about the methodology. The first step in this study was an in-depth literature review to find out what kinds of information had already been gathered and what the trends were and the results of those prior studies. We also conducted in-depth interviews with veterinarians as well as with pet owners, and then used that information to design a national survey of pet owners. This was an online survey of about 2,000 pet owners. The demographics of those pet owners matches the demographics of pet owners the demographics of that survey population The demographics of that survey sample matches the demographics of the pet owner population as a whole. This study has a very high level of statistical reliability at the 95% confidence interval. That's plus or minus 2.1% for the results overall, and plus or minus 3% per species, so for the dog or cat results. A national survey of veterinarians will be conducted in the second quarter of 2011 to follow up on some of the information gained from this initial survey. So, key findings. Most practitioners don't know that visits are declining. They may know that their practice isn't as busy as it was before. They may notice that there are more open appointment slots than there used to be, but they don't really track visits. There are 6 key factors which are limiting veterinary visits. Veterinarians can impact the 3 most important ones. There are also very specific actions that each practice can take to grow client traffic and reverse this trend. And one of the most important findings of the study is that there are specific things that can be done that there is every likelihood will reverse this trend.